I'm Zoe Lockert. I am a social work supervisor at Hospice of Petaluma.
Hi, I'm Mindy Toth. I'm 70 years old. I also work here at Hospice of Petaluma, which is in Sonoma County, Northern California, just north of San Francisco. I've been here with this health system for almost 17 years, and I've been with hospice a little over 11 years.
Let's start with what drew you to nursing.
In 1967, when I was still in high school, I did a nurse's aide training. They were called pink aides in my local community hospital. But it was a really, really good formalized training. When I also think back, what made me even want to do that? My mother, the neighborhood we lived in, had a lot of friends. And I remember a couple times being with them in the group, and a few of them were nurses, hearing them tell these incredible stories of their experiences. And I was intrigued. I was totally intrigued. And I think that sort of fed something there. And then when I knew my local community hospital was doing this training program that summer, I thought, well, I'll do that. So I continued to work as an aide through the rest of high school and ended up going into college, into a baccalaureate program for nursing, which at that time, there were not that many colleges that offered a Bachelor of Science degree in nursing. I went to school in New England. I had a good education. I've been a nurse 48 years. I've had a great variety of experiences, everything from working in hospitals to actually many years of my nursing career have been working in the community, doing visiting nursing, working with community case management programs. I also lived overseas in an international spiritually based community in South India. I worked there working as a nurse in their little local clinic, which serviced the villagers as well as the people of our community. The midwife in the community where I lived wanted a partner, and even though I was not formally trained as a midwife, I apprenticed with her and did home births. Finishing my career working in hospice feels like the perfect ending to my career. It kind of blends in my spiritual experience of having lived in that community. It pulls in a lot of my managerial experiences that I've had because now I work as a supervisor. It just feels like the perfect blending of everything that I've done. What I love about nursing, which is to be with people, helping them heal or supporting them in their non-healing. I remember sitting next to patients who were dying and they didn't have anyone there. In those days, people stayed in the hospitals for a long time. Today, hospitals are for acute care. They come in, they have their surgery, they get their acute illness fixed, and they're out. I used to really enjoy being able to sit by people's bedside. I feel sad for the hospital nurses. I don't think they get the time to just sit and be by someone's bedside as much.
What are some of your most rewarding experiences, either as a nurse patient or as a leader?
A nurse was having and I can't even remember the particulars actually, but I know she was having a really kind of difficult, challenging situation with a patient and a family. So she came in to me and we spoke and we talked and we aired things. And I remember sharing with her at that time a story of my own experience when I was living in India. I was assisting at a birth, and the birth did not go ideally like the woman had planned. And she ended up having to be taken to the hospital and couldn't have a home birth. When I came back and got some rest and I talked to the midwife, and that midwife that I worked with said to me, she says, Mindy, you're not the writer of the story. You're not the director of the story. You are one player. You came in stage right and you exit stage left. And I just remember sharing that story with this nurse, and it really helped her to let go of the attachment.
That's really excellent. It translates so well to our hospice work because we don't get to say how someone dies. They do it their way.
Exactly. They may not have that, quote, good death. They're going to have what they need to have. We can facilitate, we can support, we can teach, but it is their story.